first and foremost, depending on the level of mental health issues, if somebody is being under a psychiatric care medication, I strongly recommend and request, please connect with your treating doctor, take the medication, and follow the basic instructions, whether it is related to exercise or sleep quality or basic nutrition. Many times, because if the level of mental illness is severe, individuals are not coherent enough to have that self discipline or self regulation. It is important for the family, caregiver, or the concerned individuals to have those important factors which I mentioned in place. Somebody, if it's, I'll give an example as simple as anxiety. So, a lot of people who've had social anxiety issues prior to the pandemic, they have thrived very well because they didn't have much exposure or the need to interact with people in person. But there are people who are totally extrovert or sometimes having conditions like mm, attention deficit hyperactivity disorder. I'm talking about adult population. So for them to be sitting cooped up in a house during lockdown was a precipitating factor for depression and isolation, which resulted into more maladaptive behavior as seeking support of nicotine or alcohol or other substance abuse material. So we have to look into these aspects. Again, I'm repeating, seeking the mental health, professional help, or reaching out to your general practitioner, your general doctor, and expressing. Suppose somebody doesn't have access to these kind of information, if you have some confident friend, cousin, family member, tell to them, "He, right now I'm facing this. Is there any way forward where I can get better support or care or help?" So, basic as letting out your internal turmoil, internal stress, the self dialogue which we keep on having continuously can be a exacerbating part of the mental health issues. So if we have those kind of scenarios, it is important that we make a connect point with the required professional. It can be a psychologist, it can be a psychiatrist, it can be a general physician, or even the community nurse or the community leader if they understand the scenario. But make that reach out. There are a lot of 24 into 7 good helplines. Use the internet power to reach out and let out your boiling emotions so your quality of life improves.